I'm getting ready to sign my family up for a health insurance plan for 2022, and it'll be the 9th time we've gone through this process in only 4 years. And in that time, we've been on pretty much every type of plan imaginable. A PPO, an HMO, a high deductible plan, a low deductible plan. We've been on employer plans, marketplace plans, and even a Medicaid plan. I've learned a lot about analyzing health plans strategically, and I'm going to share with you the mistakes that people make too often with choosing a health insurance plan. The first step is ignoring those high deductible plans with HSAs. A lot of people just pass right by those plans because they're afraid of what might happen if they have a big medical expense. They see that the deductible's over $10,000 and they're thinking, I cannot possibly afford that. But if you're a family that has low medical expenses, choosing that high deductible plan could save you thousands of dollars on monthly premiums. And if you do have to pay the cost of a few medical things through the year, it's likely those things are only going to cost you a few $100s. So you're still going to be ahead by a lot. Also keep in mind that when you're paying 100% of the cost before you hit the deductible, you're paying the full insurance rate for that, not the full cash rate. So it might not be as bad as you think. The other group of people that could really benefit from these high deductible plans, surprisingly, can sometimes be people with very high medical expenses. The reason is that usually with these plans, once you meet that high deductible, everything 100% is completely covered after that point. You're not going to have any more copays, coinsurance. The other thing to pay attention to is whether an employer offers you some free money in your HSA. And if they give you that money and you don't use it, it's yours to keep forever. Remember that HSAs are not like FSAs in that the money does not go away at the end of the year. If you want me to make another video about HSAs and FSAs, let me know down in the comments. I'd be happy to make one. But I want to get back to health plans. The next mistake that a lot of people make is looking at the monthly cost of the health plan instead of looking at the overall yearly cost. This sometimes can bring to light things you didn't notice when you're just looking at the monthly cost. For example, on our current plan options, I added up the premiums for the whole year on the low deductible plan versus the medium deductible plan. And I realized that the low deductible plan was so expensive that it never made sense to choose that regardless of what kind of medical expenses you would have. I'm not saying yours is going to have something like this, but just add up the yearly cost and see what difference it's going to make in the long run. It might show you something different about the plans. The next mistake is not considering your own personal psychology related to choosing a health plan. My friend was telling me about they choose a low deductible plan with inexpensive copays, partly because her husband is one of those people that really hates going to the doctor, and he's also a pretty frugal guy. So if he hears that going to a doctor is going to cost him $150 out of their HSA account, he's not going to go. But if it's only going to cost him a $20 copay to go to the doctor, he's going to be more willing. Since she cares about her husband's health, she'd rather just choose the more expensive plan and know that he's going to go to the doctor when he needs to. The next mistake is not understanding the difference between a copay and coinsurance. A copay is a flat rate that you pay for a doctor's visit or medical service. For example, you might have a $20 copay to visit your primary care doctor. A coinsurance is a percentage that you pay. So you might have a 20% coinsurance for a doctor's visit. At first glance, it might seem like copays are a better deal than a coinsurance, but that's not always true. Again, you're talking about a percentage of that insurance rate, which is lower than you think a lot of times. For example, one plan I had a $60 copay for visiting specialist doctors. But that included quick follow-up visits with my son's ENT, and the receptionist told me that my copay was actually almost the full price of the visit because a quick follow-up visit only cost about $60. So if I'd had a 20% copay, it would have only cost $12 instead of my $60 copay. So just think about which one is going to be a better deal for you. The next mistake is not reading the fine print on your plan options. Many health plans don't cover some things that you might think they do. Some examples of this are treatment for infertility, speech therapy, except in certain situations, and hearing aids. There are also often limits on how many visits you can have to things like a chiropractor or physical therapy. Next mistake is not checking if your doctors are on your plan. Some plans may have a price for in-network doctors and out-of-network doctors, but you'll often pay a lot more if you go to an out-of-network doctor. These are usually called PPO plans, which stands for Preferred Provider Organization. But there are certain plans that do not offer any coverage outside of their network. These are usually HMO plans or Health Maintenance Organization plans. The HMO plans tend to be less expensive per month, but you are limited to only the doctors inside your plan. The only time you're going to be able to get care outside of that network is if you're outside of your geographical area or you need emergency care. Next mistake is not accepting that choosing a health plan, it is a gamble. You really are trying to predict what your health expenses are going to be for the next year and trying to choose which one is going to be least expensive for you based on your own unique situation. You never know what's going to come the next year, and sometimes the one you think is going to be the least expensive doesn't work out the way you thought. Just don't beat yourself up if later you realize a different plan would have been a better deal. I've certainly been there before. Hope you like this video. Next up, check out this other great video that I know you're going to love.